so much, Kit, and thank you, Vincent, for that very interesting question. I'm going to suggest that we move on to the next talk now. So again, thanks, Kit, that's brilliant. What I would say is that Kit has very kindly agreed to join us for the discussion at the end. So any more specific questions for Kit can be raised then. But now, without further ado, I'd like to move on to our next talk, which is the last one before the discussion. And this is a talk by Sebastian Funk from LSHTM, London School of Hygiene and Tropical Medicine. Sebastian's going to talk about integrated disease models that account for behavioural factors progress since the 9 Challenges paper.
Thank you very much. And thank you very much for inviting me. So I'm going to share my screen. Always nice to be given a title by someone else, so you don't have to think about a catchy one yourself. So I've been asked to reflect on progress since we wrote a paper that itself came out of a Newton Institute workshop now 6-7 years ago, a several-week program where we came up with these challenge papers, and one of them was this. Next slide. Yeah. Not this one, but this one. On incorporating dynamics of behavior in infectious disease models. And I guess the sort of happy story now would be if I had spent the last 6 years working on this and addressing most of them, but in fact I haven't. In fact, I haven't recently been working on behavior in infectious diseases, and so I speak of this largely as a bit of an outsider, and my views on this will be necessarily incomplete and subjective, and apologies to anyone whose work I might be missing in my subjective assessment of this. Before talking about the specific challenges that we posed, I just want to highlight another paper, an opinion piece that was published almost 10 years earlier by Neil Ferguson on capturing human behavior. And if you look at the subtitle, understanding the dynamics of infectious disease transmission demands a holistic approach, yet today's models largely ignore how epidemics change individual behavior, then this still holds very much true, I think. So 15 years later, I don't think this is something that has changed much. If you think about the models that have really influenced policy and the models that, for example, in the UK have influenced policy, there's no element there of epidemics changing individual behavior. It's not to say that there isn't more work having been done, and I think Kit showed a really interesting example of that earlier. But I think again, the models that have been used for policy haven't addressed this. I highly recommend looking at this essay. I think looking back at this, to me, it really reads remarkably prescient. Coming back to our challenges, and what I'll do is I'll just go through these one by one and try to give my view on where we are with this, and specifically where we are with this with respect to the COVID-19 pandemic, because obviously this is kind of really been an event that has been shaped by individual behavior, and but also one where maybe it kind of gives a useful reference point for whether these challenges really still exist and whether they've been addressed, or whether they still are open challenges, or whether they still are useful challenges to address potentially in the future. And I won't do them in order. I'll largely do them in order, but I want to start with two that I think are maybe the most important ones. And the first one is one where I think there's been a really positive story, and that is to inform real-time data collection. And there's I think a very nice example of this, which is the COMIC study, which was started in the UK, but has since expanded to a range of European countries, funded largely by EU money. And so it's this idea that in mathematical models of infectious diseases, if you have an age-structured models, you need some kind of quantitative idea of how people of different age groups come in contact with each other. And this generally tends to change. The amount of, or the kind of how people come in contact with each other tends to change over the course of an epidemic. And so one way to be able to reliably inform models with it is to measure it. And so the COMIC study, which actually those of you who were at the session on Tuesday would have heard about it then from Amy Jimmer, is a study that on a weekly basis does exactly this. So it's really model informed data collection, where every week a key set of parameters that informs mathematical models, age-structured mathematical models of infectious disease transmission, is measured to mathematical models. A second point that I think is really relevant maybe to the broader discussion of modeling behavior in pandemics is on how and to what extent behavior should be modeled explicitly. And what we mean by, or what we meant back then by explicitly, is reflected in this distinction between exogenous and endogenous modeling of behavior. So starting with exogenous, so I just mentioned COMICs, and this is another plot from the COMIC study of how contacts changed over the course of the pandemic. And so with exogenous modeling of behavior, we observe some kind of behavior and then we integrate this in a mathematical model. So this is exactly what I just described. Is kind of, for example, we observe or we measure contact matrices, and then we can integrate them in a mathematical model. It doesn't mean that we can explain behavior. It also means that we don't really have a model for behavior, but we have a way in which observed behavior can enter a mathematical model of infectious disease transmission. And there have by now been various examples of how this is being done. With this, other models have used things like mobility data, again, something that was talked about earlier today, to inform how behavior changes, and something that can then enter a mathematical model as a parameter affecting transmission intensity. The other way of thinking about this is if we model behavior explicitly. So this is a bit like in the previous talk by Kate Yates, where the infection itself generated behavior, behavioral dynamics was modeled, and behavior itself then can affect the epidemic again. So this is something that we, for example, with Vincent, who's also here, Vincent Janssen, and others modeled a while ago, where, so this is this idea where here you have an outbreak in red, and then the current where the outbreak currently is in light red, and you have this cloud of awareness or information around it that in itself can stop the epidemic, but then you can have these outbreaks again, the kind of breakthrough of infection, and then people react to it again and mitigate the outbreak. And so you have the behavior itself as part of the mechanistic and dynamic process. I'm not aware of any models of this sort that have been used to explain any of the observed behavior in COVID-19 in a kind of data linked way. So I haven't seen any models where, for example, this change in contact, where contacts change sometimes in response to policy, but also sometimes not in response to policy, where this could be explained by what is going on with the epidemic. And as a consequence, it's really hard to predict changes in COVID-19 case trends. So this is one example from the European COVID-19 Forecast Hub, where forecasts from a range of modeling teams are being collected and integrated, and an ensemble created every week. What you see here are 1 week ahead forecasts. You see the data in black, and then the forecasts made each week in what this is, cyan. And what you can see is that whenever there's a change in trend, so the models are kind of all right at continuing an existing trend, but whenever there's a change in trend, the models tend to fail to see it. And this is because to this date, in now coming up to 2 years, and we kind of see similar things elsewhere in other countries and in other settings where similar efforts exist, forecasting trends in cases of COVID-19 is really difficult. And the reason for that is that we have no real leading indicators. And if you think of the previous slide where I showed kind of contacts changing over time, we don't really, I mentioned there, we don't have any models, any mechanisms that would explain why those contacts change or how they change. And so when a change happens, and when via some well, for whatever reason, contact behavior changes, we don't have good models for that. And that brings me then to going through the remaining challenges. And so the first one that we set out was to set a baseline and determine the effect from departing from it. And what we meant by this is that there's some kind of behavior that is kind of, well, to model behavioral change, you need to know what baseline behavior is. And we often observe behavior in the absence of disease. And so one example of a baseline behavior is what people do when they're ill. And if we measure contacts in healthy people, that might not tell us much about relevant contacts in those that are infected and infectious. And so this is one example from 2013 from the 2009 H1N1 pandemic in the UK, where again, in another study, contacts were monitored at two different, or at several time points, including in those that had currently were showing symptoms and those that weren't. And you could see that the contacts declined in those showing symptoms. And in fact, I mean, this is obviously something that we know happens in COVID-19 because of contact tracing. And we very recently had a very striking example of the effect that has when the Immensa scandal happened. And one lab in the UK was falsely reporting or falsely assessing coronavirus infected, very likely coronavirus infected people as negative. And we can see that in the areas where this happened predominantly, cases increased to a much larger degree than in surrounding regions where it didn't happen. So you can see real epidemic effects of this, and obviously contact tracing has had an effect on the epidemic throughout. So, but still to assess the effect of something like contact tracing, we would need to know what the baseline is and what people would do in the absence of any intervention. And I don't think this is something that we really do for COVID-19. And in fact, in COVID-19, it's also really important for assessing the impact of policies. So, as you're probably all aware, there have been huge discussions around COVID-19 and lockdown policy and whether lockdown was necessary. And the question is always, what would people have done if it hadn't been for lockdowns? And I don't think we have a good handle on this, partly because in all the settings where we have collected data on contact behavior, such as in the UK, usually the epidemic was mitigated through lockdown or related policies. And so we haven't, mercifully in this case, observed an unmitigated epidemic. I think some parts of the world that have seen unmitigated epidemics, we don't really have those observations of behavior, so we can't really relate those. We might have some ideas of it, but I don't think we have a good quantitative understanding of how this happens. We talked about back then. We were trying to assess the minimal level of detail required to model differences in behavior. I don't have really much to add on this for COVID-19, especially because we haven't really got good models of behavior with respect to COVID-19. There is a question, so we're not very good at, or haven't been very good at predicting population level or modeling population level behavior. And so whether this is easier or possible at a more detailed or individual level, I don't know, but it seems this continues to be an unanswered question. We talked about quantified changes in reporting behavior, something that's really important for interpreting data. And again, this is something where I think there's been some positive development in COVID-19, and especially in the UK, where we have had the ONS study of randomized community testing that has been a real, such an important part of situational awareness for the current state of the pandemic in the UK, where through testing random households, we get a measure of COVID-19 prevalence through time that is unbiased by testing capacity or individual behavior with respect to seeking out a test when infectious. And so we can compare this to the self-initiated testing. So this is just the case data over time, sort of trying to match these roughly in time. And if you divide one by the other, you get some estimate of the proportion of people with symptoms that came forward for a test. Now with this, now we can quantify this and we can look at this, but we have the same problem that we had before when I mentioned the changes in contact behavior, which is that we observe changes in trend over time, but we don't really have good explanations for why they happened and why people may have had, if that is the interpretation of this, if people had different predispositions of coming forward for a test with symptoms, why that would have been the case over time. Again, which is what we would really need to do in order to really understand this. We said then that one challenge with respect to behavior was to predict the responses to interventions and health campaigns. So another very pertinent issue with respect to the pandemic, and something that we've seen is that the same intervention, so I'm just putting an example here of one paper where this was examined in great detail, and where it was found that the same intervention can have very different effects at different times when applied in the same place. Also have very different effects in different places when applied at the same time. And again, it's something that I don't think, at least at the modeling community, we don't have a good handle on. We talked about identifying the role of movement and travel as a challenge, and this I think is something where actually through the wide availability of movement data, there has been quite a lot of really informative work in the pandemic, both in terms of some very nice work by Kramer and others on the early dispersal of COVID-19 in China, and then quite recently, really nice work on the spread of early SARS coronavirus 2 early in the pandemic in Europe, and the huge scale up of the availability of pathogen genomic data has also helped with this. So I think we really can say that there's been real progress in understanding the role of movement and travel in, well, at least early on in the pandemic, which is obviously quite a crucial period for understanding the pandemic. We also talked about developing models that can be verified against data from digital sources. And what we were particularly highlighting was the need to kind of use things like social media data, or explore the use of social media data for better understanding infectious disease transmission. That is something where I'm not aware of any significant contribution having been of these kind of data sources having made any significant contribution during the pandemic, at least not beyond the already mentioned movement data. So such as here, so this is a kind of Google mobility data that's been used by a lot of models for understanding, or for not for understanding, but for capturing and quantifying changes in behavior. So in terms of kind of tracing individuals' behavior, there's been the way this kind of data has made a contribution to modeling the epidemic was through mobility data, and much less through social media data, such as, I don't know, following Twitter text or other things, which I think some time ago was seen as a very promising avenue. I mean, it's sort of interesting to reflect on Google flu trends and how that was seen as revolutionary at the time, or at least sold as revolutionary at the time. Nothing of that sort has cropped up during the pandemic, really. The last one, and a really important one, I think, was the plea that we put out for engaging in a dialogue across disciplines. I was sort of I had a small affiliation or a small involvement in a recent, much more comprehensive view on this, which I recommend looking at and engaging with. I thought it was a very nice, broad perspective on this idea of engaging, of modelers engaging not just with clinicians and broader epidemiologists, but also with social scientists to better understand how behavioral or social parameters could be integrated in models and have some kind of feedback loop in that, I think that still remains the kind of, if one wants to do this properly, that still remains the ideal way of doing it, even if really not done commonly in practice, at least in my as far as I'm aware. So these were the 9 challenges. Pretty quick tour through these and how I think they've played out in the pandemic. What we can conclude is that on the one hand, there's certainly been some progress in that, contrary to previous outbreaks and epidemics. I think there has been positive change in that data collection has been informed by models. I think that's still may be far from perfect, but I think that has really been a positive contribution. On the other hand, we haven't really learned how to model behavior in the pandemic, and so as a consequence, we don't really have any way of predicting what's going to happen, and we haven't seen the emergence of these kind of endogenous behavioral components in models that inform policy. And so I think the open challenges remain, well, whether we can change that, and maybe we can't, and maybe that is the answer to the question of whether we model behavior endogenously or exogenously. Maybe we can't go beyond kind of understanding kind of very broad kind of theoretical interactions between behavior and disease, and maybe that is all the value we can get, and there's obviously value in that in itself, as again referring to the previous talk, which I thought really nicely illustrated some of these relationships. And I think as a general challenge to the field, so this is actually a quote from a talk that I gave 10 years ago, and I don't think I've seen a positive answer to that, which is, are there any patterns in observed infectious disease dynamics that we can only understand, or that we can better understand by including a behavioral model? I think that remains a main challenge. And with that, I conclude, and thank you very much for listening.
Thank you so much, Sebastian. That's really, really interesting, and I can already see some stuff coming up in the chat. I don't know if you can access that. Kit Yates has got a hand up. So Kit, do you want to?
Oh, no, I was applauding, Jane. Sorry.
Sorry.
I was applauding. Sorry.
Oh,
it was an applause.
Right. Okay. There you are. You've had some applause there, Sebastian. So yeah, there were some points made in the chat. Samuel mentioned about Google tried to do a flu model based on scraping data from Twitter, social media. Not sure what happened to that. And then there's some comments around that. But this looks more like a question here from William. Is making concrete predictions the only way to inform policy?
Yeah, very much not. And I mean, that's an excellent question, and maybe a challenge to something I stated slightly too provocatively in the end. But I think what remains, I think there are two main ways of informing policy. One is to improve our understanding, and one is to make predictions. And I don't think either of these has really been addressed with respect to better understanding the pandemic.
Okay, thank you. So do I have any more questions then, please? Please do show your hand or pop them into chat. Flavio.
Thanks, Sebastian. I think that was a really fantastic talk, and it's also setting up nicely for tomorrow's session. We're going to talk about many of these things. So I actually did not know about this challenges paper, and it kind of begs the question, if people have known that there are these shortcomings for so long, why do you think there's been so little progress in trying to incorporate these behavioral aspects more tightly into the models? I mean, I think there's a thick irony here that the paper you showed in Nature was from Ferguson, who is one of the driving forces of the models we've been using during at least the early stages of the epidemic. I mean, I know it's a little bit, you know, playing the devil's advocate, but he should know better. So what? I mean, I'm not saying he is an obvious thing how to do it, but you must have made some thoughts about why there's such slow progress.
Yeah, I mean, the simple answer is because it's really hard, and I think it is really hard, and it's also perhaps not to be underestimated just what a singular event this pandemic is, and so behavior might be more, you know, maybe that's the hardest question, really, the one that I focused on in this talk is how to do this for a novel pandemic, and you know, maybe there is maybe a greater role, or maybe it's easier, a problem that's easier to address is individual behavior, how individual behavior shapes annual flu epidemics, or something that's, you know, maybe less affected by changing policy. I mean, there's just been so much interacting in the pandemic that I think, to me, I don't think it's for lack of appreciation that this is something that should be done. I think it's more because it's really hard, and also because you know, maybe sometimes we're lacking the data, although arguably in this case the data is there, but maybe it's just still really hard.
Thank you, Sebastian. Ed has his hand up now.
Yeah, thank you, Seb. That's really nice talk, and perhaps more a general theme, overarching theme to this question is regarding like social media, and I suppose and things like Google flu trends, is ultimately how much could we feasibly actually learn from such platforms, given social media sphere itself is dynamic and changing over time, and thinking about there's different generational uptakes and there's like newcomers onto that scene quite frequently. And so in a sense, with the speed with that timescale where the social media sphere is kind of updating itself, if we try and learn from it, are we always going to be behind to some extent? And therefore is it other data streams? Therefore it's like we should be prioritizing these data streams as these will be perhaps more robust longer term versus, oh right, social media, we have lots of data, so that can surely give us some answer. Yeah, perhaps a broader level question.
Well, I think you answered it yourself. No, I think it's probably true what you say, is that it's you know, it's difficult, and I mean, I think one of the reasons, for example, Google mobility data has been used so much is because it was made available in an easily quantified format, whereas working with social media data maybe is a bit more messy and difficult because of that. And I mean, I remember there was some nice work many years ago on differences in vaccination uptake for, I think, was it measles or flu in the US, and some relationship with, I mean, so Twitter messages were analyzed in different states for sentiment expressed in them towards vaccines, and then some correlation was found between that and true vaccine uptake. I don't know if anyone's tried to do that for COVID. Maybe that would be possible, but I think it's also, again, and you know, it's difficult and requires sophisticated methods, turning over a lot of data that I think by now has become quite costly, because also the social media companies are not allowing access to data as it used to be. Yeah, it was Marcel Sarte's work, exactly. So that might be another reason.
Thanks very much, Sebastian. Samuel has got his hand up, and what I would suggest is that after we've dealt with Samuel's question, we might want to move into the wider challenges, because Sebastian has also very kindly agreed to stay on for the discussion, so there's plenty of time for that. And I would just quickly say that Julia has very helpfully posted in chat the link to the challenges paper, which, as she points out, was part of special issue of epidemics in 2015. Following the 2013 INI programme. So that is in the chat, so you can follow the link. So Samuel, please do ask your question.
Yeah, so it's a sort of question, and maybe bleeds into the discussion, because a sort of challenge that I think it's relevant to what you're saying, Seb, that you maybe didn't include is that also, I don't think epi models had ever really been asked to do what they're being asked to do now, which is this sort of sequential now and near casting. And so a lot of the stuff, so sort of maybe slightly addressing Flavio's point as well, a lot of the stuff in the social dynamics sphere is a lot like, well, if there was a pandemic, there would be people would reduce their mobility, but there was never a belief that there would be things like vaccines that would come in less than 1 year. And so there was always a feeling that this would be, that you could have something where there was like a temporary perturbation early on in a pandemic, but eventually people would sort of go back to normal, and like your long-term forecasts would probably all converge onto a similar place. And this idea that, you're going to be asked, what is the hospitalizations next week and the week after? And the policymakers want you to be right every single week. And the thing Seb showed up about, like, you really should be tracing how accurate your near-term forecasts are. That sphere was not even being asked. And that's like a sphere of accuracy where you need to be really on it with the social mobility as well. And it was kind of like, although Seb is basically, he's too modest, but he's a visionary on this stuff. Because I remember being in talks like 10 years ago, I was just like, no, we'll never need to know epidemics in that detail, which Seb was giving. So it's not just how difficult the question is. It's like, I don't think people were expecting to be asked such finely resolved questions about the modeling. It was more like kind of big picture kind of things.
Thank you. Thanks very much for that, Samuel. And thank you again to Sebastian and all our other wonderful speakers this afternoon. I'd like to hand over now to our Q&A discussion chairs, Ed Hill and Flavio Toxvard again, to lead the discussion.
Okay.